Expanding conversations on mental health awareness this month. It's important to address how children are being impacted.
Roughly 1 in 6 youth are dealing with a mental health issue right now, according to indie agency Child Advocates. Joining us now is News8's multicultural reporter, Katira Winfrey. Katira, such an important issue.
Such an important issue, and you can listen to those statistics of just how much it's impacting children. Now, the Indiana's Division of Mental Health and Addiction named Child Advocates as the state's access point to connect children to mental health resources. Since rolling the program out Monday, nearly 50 cases have already been referred, and representatives say with child suicide rates growing, it's important to act now.
Mental health issues reaches into every pocket of the population, and some of the youngest are feeling its impact even harder. An estimated 1 in 6 youth are coping with mental health trauma, and only half will seek treatment.
Mental illness and its treatment among children is a really important issue right now. All of us know how the pandemic affected us.
Cindy Booth is CEO of Child Advocates, the agency the DMHA, Department of Mental Health and Addiction, has named as the single statewide access site for a new program. It's called the Child's Mental Health Wraparound, a program providing support to Hoosier kids battling serious mental health and behavioral issues.
With children having gone through the pandemic, being isolated from school, all the things that have happened in our society and our community.
Families can now streamline access to support by dialing 211 and offering up keywords like mental health and wraparound services. The resources will be available at low cost or free to families who qualify for Medicaid, and families who don't qualify can still get support independently through Child Advocates.
One of the directives that we have from DMHA, the Division of Mental Health and Addiction, is to reach out to African American, Latino, and LGBTQ+ communities because a lot of times the outcomes for them are not as good.
Representatives say the pandemic's isolation, unrest, and protests around social justice have had mental impacts on kids.
We can't just see that and say, well, that's just what happened after a pandemic. We need to really take care of that.
And now Child Advocates say they are also going to work with outside agencies to meet the need as they expect to see an influx of cases. Reporting in the studio, I'm Wish TV News 8's multicultural reporter, Katira Winfrey.